Hello, my name is Grace Bondurant, and I'm partnering with Aaron Toblong to talk about nursing shortage and possible solutions. This is part two of the presentation. For your convenience, this is a breakdown of the responsibilities, who did what part of the presentation. Aaron performed the objectives, introduction, background, problem statement, and literature review up to the residency programs. And I'm going to start with the support staff part of the literature review all the way up to the conclusions and references. Aaron discussed residency programs as being one of the possible solutions to nursing shortages. Now I'm going to talk about support staff. In a study by Lynn and Redmond, they talked to different nurses from all over the country, and they asked them what they thought the top 16 possible solutions to the nursing shortage would be, and 75% of those participants chose hiring more support staff. And the study by Ulrich echoed this decision, where they said use of nurses' aides such as LPNs, techs, CNAs, and other support staff was ranked as the top 9 in their study. The problem with not having enough support staff in terms of LPNs, techs, CNAs is that when you have less support staff, the nurses end up having to pick up those tasks instead of doing their nursing tasks. So more time is spent on non-nursing activities such as prepping with meals, transporting patients, turning them, making sure they have water. And this is actually a waste of nurses' expertise when they could be doing assessments or medication administration. And when a nurse feels like they have to pick up not only their own job, but perform other jobs that not necessarily is under their job description or could be easily delegated to someone else, this leads to burnout, which leads to job dissatisfaction, lack of motivation, and turnover. And the turnover rate is directly related to the nursing shortage. Why we don't have enough is because people don't feel that they can perform their duties without adequate support staff to help them perform the tasks. It's unsurprising that the next possible solution mentioned would be pay and benefits. Money seems to always be a good solution and a good motivator to help people stay in their working environment. Ulrich's study had a survey of 83 respondents, and they all agreed that improving wages and benefits would be one of the best ways to solve the nursing shortage. This is also echoed by Leong, who did a study in Macau, and he said that pay scales and benefits are probably outdated and thus should be reconsidered. Honestly, the salaries haven't changed much over the years, and they kind of stagnated, and administrators need to make sure that the salaries and benefits are reflective of the competitive job market and they reflect the current rate of inflation in order to stay relevant and so people have an incentive to stay with their facility rather than moving on to a different career. Gooden also agrees, saying that nurses should be compensated accordingly based on their differing levels of preparation, responsibility, and performance. And many hospitals do follow this, but many do not. Many nurses will get a starting base pay based on their lack of experiences, and as they earn more experience and get older, they'll get a higher salary. But oftentimes, I don't find this is adequate, or that it takes too long to get those increases in pay, and that it's not significant enough to make much of a difference. Here are some fun facts about pay and benefits. Back in the 2000s, the average nursing salary was $44,840, and honestly, not much has changed since then. These numbers haven't really these haven't gotten any higher. One of the ways that hospitals try to get around this, rather than just increasing everyone's salary, is with sign-on bonuses. Oftentimes, you'll see on applications that they'll say, "Oh, if you get hired for this job, your base pay." But on top of that, you'll get a $10,000 sign-on bonus. And this is really good for recruiting new people and getting them to come into the job quickly, but it's not good long-term for retention because people would rather have a constant, continuous increased salary, which gives them more money over time rather than a short-term fix of getting a sign-on bonus. And an interesting thing that I found was with Nardi and Gierko, who are two authors of a different study, where they discovered that the nursing shortage does not just apply to nurses in the hospitals or other facilities, but also nursing faculty of like universities. And maybe people might think, what does this have to do with anything? But it relates directly to the nursing shortage, because if there aren't enough nursing professors, there's not going to be as many nursing students that can be enrolled in these courses. So that directly affects how many nurses are graduating and being able to go into the job market. And nursing professors are finding that they would have more incentive to stay in their jobs of being a nursing faculty or even go into that field if they were compensated for all the different conferences they had to go to and meetings and continuing education and supplies that they use for their classrooms. So they feel that's coming out of pocket and they're not being adequately compensated for these things. And if we had more nursing faculty, we'd have more nursing students and therefore more nurses to fix the turnover rates and the shortages that we have. So many people who listen to this or hear about it in the news might wonder, okay, so there's a nursing shortage, but why does it matter People who are not in the medical field or regular patients, they might think, isn't that just an inconvenience to scheduling managers? But it's important to realize that nursing ratios directly affect quality of care. The more nurses you have, the more time you can spend with your patients, and the less chance they have of having negative outcomes. And so, really, it's in the patient's best interest to advocate for more staffing because it means that they're going to get better cared of and that they're going to receive the best possible care that they can. Now, there were many recommendations in all of the articles that we read, but it basically boiled down to two, or that number one being that new nurses not be considered, especially in places that have a higher acuity or higher nurse-patient ratio. The study was done by Leong, which was an article in Macau that looked at long-term care facilities, and he said that new nurses typically just didn't have quality training or enough orientation or have the skill set to be able to handle acute situations properly or be able to handle the high nurse-patient ratio, and that other nurses are too busy to really focus on that. They viewed it as not their job to take care of the new ones. And the second one, which is kind of obvious, is that have more staff per patient, because the more nurses you have per patient, the less chance you have of developing pressure ulcers, UTIs, dehydration, and other quality of life factors. And so to summarize, basically we know the problem is that baby boomers are retiring and it's leaving a lot of job openings that need to be filled. We need to recruit and retain new nurses. And so to summarize what we've talked about, some of these possible solutions that have been brought up is to increase the amount of residency programs to help new nurses feel comfortable where they're at and give them the training set they need, to hire more support staff to help the nurses perform the tasks that they need to get done so they don't have to do everything themselves and get burned out, and also to increase the pay and benefits to compensate people for their time and their experience. Thank you so much for listening. And for your convenience, this is a list of our references.